Sergio Sebastian Martinez, the name of an amazing young man whose journey in life was ended all too soon. He is more like a brother than a cousin, and at times it feels like a dream he is no longer here. On December 8th of 2017, Sergio lost his battle to acute lymphoblastic leukemia. I want to go over the importance of becoming a registered bone marrow donor and how registering can help those suffering through blood diseases and blood cancers. The one thing Sergio needed was a matching bone marrow donor. Our family and friends prayed for the day that Sergio would receive the news that a match was found and he would be given a second chance at life. Today, I want to discuss with you the three types stem cells are donated, how donors and recipients are matched, and why you should become a registered bone marrow donor. I am sure that if you received the news one day that a loved one is in need of a marrow transplant, you would do everything you possibly could to help. Not enough people are registered donors, and we need more registered donors to be able to help our loved ones survive these blood cancers and blood diseases. There are three ways in which stem cells are collected: bone marrow, peripheral stem cells, and umbilical cord blood. When a donor undergoes bone marrow stem cell donation, the marrow is taken from the hip bone while the donor is placed under general anesthesia. During this procedure, about 10% or 2 pints will be collected and may take 1 to 2 hours. Your body will replace these cells within 4 to 6 weeks, and most donors are back to their regular activities within 2 to 3 days. Just like any other procedure, there may be some rare complications along the way. Through a personal conversation with John Philpott, a Marrow recipient and community engagement leader for BeTheMatch.org, he stated that this procedure typically takes place when a recipient's doctor requests it or when the recipient is a child. He also stated that most donors have compared the pain and bruising to that of skating and falling on your bottom. The second collection and the most common is peripheral stem cell, used in 75% of donation cases. This is an outpatient procedure and typically takes 4 to 8 hours on 1 to 2 consecutive days. During this procedure, the donor will have a catheter placed in their arm to allow for blood to flow through a machine that separates out the blood stem cells. The blood is then returned back to the donor through the same catheter or through a separate catheter on the other arm. Sometimes patients will use this method on themselves as well. However, it is hard to get enough stem cells if the patient has cancer. To me, this is a similar way to the way one would donate blood. The third way is through umbilical cord blood. This method occurs when a mother has given birth and the blood is pulled from the cord that is attached to the placenta. I had the honor of donating this way 2.5 years ago. I ordered my donation kit and took it with me to the hospital when the delivery time came. Unfortunately, you are not able to order these kits anymore, and not many hospitals will offer this method. You now have to deliver at a hospital that offers cord blood donation and make prior arrangements to delivery. According to DKMS, a Marrow registry, you have a 1 in 430 chance of becoming called as a possible match for a patient. Each year, there are roughly 5,000 people that will undergo a marrow transplant. When someone is in need of a transplant, they look to the family first. 20 to 25% of the time, a match is found. 75 to 80% of the time, they have to look through the registry. You can order a kit online and have it sent to you for a cheek swab, which will contain your DNA. According to BeTheMatch.org, donors and recipients are matched based off of their human leukocyte antigen, HLA, which is a protein found on most cells in your body. Half of your HLA markers will come from each of your parents, and a minimum of 6 of these HLA are tested for from your cheek swab. If there is more than one possible match, the recipient's doctor will request that additional testing be done to find a closer match. Only 8% of these donors that get additional testing done will go on to donate. Acute lymphoblastic leukemia, Hodgkin's lymphoma, severe aplastic anemia, pure red cell aplasia, and sickle cell disease are just a few of many diseases and cancers that can be treated with a marrow transplant. The best chance at finding a match is to look through a donor's ethnic background. The following is the likelihood of finding a match on a registry. Caucasian, 77%. American Indian or Native Alaskan, 57%. Hispanic or Latino, 46%. Asian or Pacific Islander, 41%. African American, 21%. If you are of a diverse ethnic background, the chances of you finding a match get smaller and smaller with each ethnic group, and you are all desperately needed. If you are between the ages of 18 and 44, have donor on your license, and donate blood to help others, then donating marrow is for you. There may be some health guidelines that may disqualify you, and I ask that you visit bethematch.org to review these guidelines. If you become a registered Marrow, please have it in your heart to help anyone in need. Be 100% all in. I ask this because many times when a donor is called upon for a possible match, they decline because it is not for a loved one or a family member. Just imagine how the donor felt and their family receiving this news. When a patient looks to the registry for a match, it is because they have no other choice and they will die without this match. Some people will use I hate needles, I don't like hospitals, or that's a lot to go through. If these are things that have crossed your mind, put yourself in Sergio's position. My cousin didn't like needles. He was not a fan of them at all. But yet he had to get poked multiple times a day to undergo testing and treatments. He didn't want to sit in a hospital days on end either. But when they have these illnesses, they have no other choice. At this point in my speech, 2 more people will have been diagnosed with another cancer like leukemia. In the United States, every 3 minutes there is another person that is diagnosed. Today we went over the types of stem cell donations, how donors and recipients are matched, and why you should become a registered marrow donor. Remember, the most common way is peripheral stem cell, which is in the arm through a catheter. You will help someone survive a blood cancer or a blood disease and be back to yourself within a few days. Give those who are suffering a blood disease or a blood cancer hope to find a match one day. Do not let your fear get in the way of becoming a donor. Get registered, encourage others to register, stand tall and say, I am a registered bone marrow donor.